So the patients that I typically see at the Cleveland Clinic are patients who have common as well as unusual blood clotting disorders. I see patients with common as well as rare blood vessel diseases. I have a particular interest in aneurysmal disease, so areas of blood vessels that are abnormally shaped or have areas where they're weaker and prone to rupture. I really enjoy caring for those patients, and I also study that disease as well. Occasionally, I have a patient come to see me for a disorder they think they have, but I diagnose them with something completely different. I had that experience fairly recently. I diagnosed a patient with a rare form of cancer that looked like it was a blood vessel disorder. The patient came from another state and was incredibly happy, but had the undue anxiety that, what do I do now? What do I do with this information? And it was very satisfying to tell the patient that I don't want you to worry about this, because as an institution, I know exactly who we need to go to get you treated for this. And just think of me as your primary care physician while you're at Cleveland Clinic. Everybody is extraordinarily professional here. And I think that patients sense that. And I maybe should have suspected that, having taken care of patients from Cleveland Clinic and other institutions. But they feel special when they're here. And I think they know that when they're here, they're family. It's not a job to us. This is who we are. And we're always talking about our patients to each other, especially the most complicated patients. And I think that if you have an institution that is the minimum standard for working here, I think that only translates into much better care for the patient and more considerate care for the patient.